Top 8 Natural Hacks to Relieve Bone and Joint Pain, Senior Care. If you've been waking up with aching joints or feeling stiffness in your bones, you're not alone. Millions of people worldwide deal with joint pain and inflammation every day, impacting their quality of life. Whether it's in your knees, hips, or shoulders, this discomfort can make simple tasks feel daunting. Maybe you've visited a doctor who prescribed medication to ease the pain, or perhaps you're exploring natural remedies you can try from the comfort of your home. If that's you, you've come to the right place. In this video, we're diving deep into safe, evidence-based natural remedies to help alleviate joint and bone pain. Stick around until the end, because we'll share a lesser-known technique that could be a game-changer for your wellness journey. This video is for informational purposes only and should not replace advice from a healthcare provider. Always consult your doctor before trying new remedies, especially if you have existing health conditions or are on medication. Now, let's get started and explore how you can take control of your joint health naturally. To make this topic more relatable, let me share a story. A few years ago, my Aunt Sarah, a vibrant 55-year-old who loved gardening, started noticing pain in her knees. At first, she brushed it off as a sign of aging, but soon, the discomfort made it hard for her to kneel or even walk her dog. She visited her doctor, who suggested medication, but Sarah was hesitant about relying on pills long-term. Instead, she began researching natural remedies, experimenting with things like dietary changes and gentle exercises. Over time, she found a combination of strategies that not only reduced her pain but also gave her back the energy to enjoy her hobbies. Her journey inspired this video, as it showed me how small, intentional changes can make a big difference. This section isn't just about Sarah, it's about all of us who want to live fully despite physical challenges. Joint pain doesn't discriminate. It affects young athletes, busy parents, and active seniors alike. By sharing practical, science-backed remedies, we hope to empower you to find solutions that work for your body. Whether you're dealing with arthritis, post-workout soreness, or chronic inflammation, there's hope in natural approaches that complement medical care. Let's dive into the first remedy, one that's been used for centuries to soothe aching muscles and joints. 1. Epsom salt bath. Epsom salt, scientifically known as magnesium sulfate, has a long history as a natural remedy for muscle and joint pain. Its key component, magnesium, is a mineral that plays a vital role in muscle relaxation and nerve function. Research, such as a 2017 study published in the Journal of Trace Elements in Medicine and Biology, highlights that magnesium deficiency is common, affecting up to 50% of adults in the United States. Low magnesium levels can exacerbate inflammation and pain, making Epsom salt baths a promising solution for those with joint discomfort. When you dissolve Epsom salt in warm water, the magnesium is absorbed through your skin, potentially replenishing your body's stores. This process can help relax tense muscles, reduce swelling, and ease pain associated with conditions like osteoarthritis, fibromyalgia, or general joint soreness. The warmth of the bath also promotes blood flow, further aiding in muscle relaxation. To prepare an Epsom salt bath, fill your tub with warm, not scalding, water and add 1 to 2 cups of high-quality Epsom salt. Stir the water to ensure the salt dissolves completely, then soak for at least 20 minutes to allow your body to absorb the minerals. You can enhance the experience by adding a few drops of lavender essential oil for a calming effect, but check with your doctor first if you have sensitive skin or allergies. For best results, aim to take an Epsom salt bath 2 to 3 times a week. It's a simple, affordable remedy that fits easily into a busy schedule. However, if you have conditions like diabetes, kidney issues, or heart disease, consult your healthcare provider before trying this, as soaking in warm water for extended periods may not be suitable for everyone. Sarah, my aunt, found that these baths were a turning point in her routine, helping her knees feel less stiff after a day in the garden. While not a cure, Epsom salt baths can be a valuable part of a holistic pain management plan. 2. Herbal teas. Next, let's explore the power of herbal teas, which offer a delicious and gentle way to combat inflammation. Many herbs contain compounds that naturally reduce swelling and pain, making them ideal for those with joint issues. According to a 2020 review in Phytotherapy Research, certain herbal teas have shown promise in managing symptoms of arthritis and other inflammatory conditions. Let's look at 3 standout options: ginger, rosehip, and willow bark. Ginger tea is a powerhouse, thanks to its high levels of phenolic compounds like gingerol. A 2019 study in Nutrients found that ginger supplementation reduced pain and stiffness in patients with osteoarthritis and rheumatoid arthritis. Brewing a cup of ginger tea is simple. Steep a few slices of fresh ginger root in hot water for 10 minutes, then strain and enjoy. You can add a touch of honey for sweetness, but avoid overloading with sugar, as it can promote inflammation. Rosehip tea, made from the fruit of the rose plant, is another excellent choice. It contains galactolipids, which have anti-inflammatory properties. A 2018 meta-analysis in the Journal of Rheumatology confirmed that rosehip extract can reduce pain in arthritis patients, often with fewer side effects than conventional medications. Look for pure rosehip tea bags at your local health store, and steep according to the package instructions. Willow bark tea, derived from the bark of the willow tree, has been used for centuries as a natural pain reliever. Its active compound, salicin, is similar to aspirin and can help reduce joint pain. A 2016 study in phytomedicine supported its efficacy for mild to moderate pain relief. However, willow bark can interact with blood thinners and other medications, so it's critical to consult your doctor before trying it. To incorporate herbal teas into your routine, aim for 1 to 2 cups daily, ideally between meals to maximize absorption. Rotate between ginger, rosehip, and willow bark to diversify the anti-inflammatory compounds you're getting. Always choose high-quality, organic teas to avoid pesticides, and be mindful of potential allergies. Sarah started drinking ginger tea every morning, and she noticed her joints felt less tender over time. While teas alone won't eliminate pain, they're a soothing addition to a healthy lifestyle. 3. Anti-inflammatory foods. What you eat plays a massive role in how your joints feel. Chronic inflammation, often fueled by poor dietary choices, can worsen bone and joint pain. A diet rich in anti-inflammatory foods can help manage symptoms and improve overall health. A 2021 study in the American Journal of Clinical Nutrition found that diets high in whole, unprocessed foods significantly reduced markers of inflammation in arthritis patients. Let's break down how to build a joint-friendly plate. First, focus on whole foods, fruits, vegetables, fish, beans, nuts, healthy fats, and whole grains. Berries, like blueberries and strawberries, are packed with antioxidants that combat inflammation. Leafy greens, such as spinach and kale, provide vitamins A and C, which support joint health. Fatty fish, like salmon and mackerel, are rich in omega-3 fatty acids, which we'll discuss in more detail later. Beans and lentils offer fiber and plant-based protein, while nuts like almonds and walnuts provide healthy fats. Healthy fats, such as those found in olive oil and avocados, are particularly important. A 2019 study in Arthritis Research and Therapy showed that monounsaturated fats in olive oil can reduce inflammatory markers in the body. Whole grains like quinoa, brown rice, and oats are also key, as they stabilize blood sugar and prevent inflammation spikes. On the flip side, limit foods that promote inflammation, sugar, refined carbohydrates, like white bread, and processed foods high in preservatives. A 2020 review in Frontiers in Nutrition linked excessive sugar intake to increased joint pain in arthritis patients. Instead of soda or candy, opt for natural sweeteners like honey in moderation, and choose whole grain bread over white. To make this practical, start by planning meals that incorporate these foods. For breakfast, try oatmeal topped with berries and walnuts. For lunch, a salad with spinach, grilled salmon, and an olive oil vinaigrette. Dinner could be a stir-fry with quinoa, broccoli, and chickpeas. Snack on fresh fruit or a handful of almonds. Sarah overhauled her diet by cutting out sugary snacks and adding more fish and greens, which she credits for her improved mobility. It's not about perfection, small, consistent changes add up. Work with a nutritionist if possible to tailor your diet to your needs, especially if you have food allergies or conditions like diabetes. By nourishing your body with anti-inflammatory foods, you're giving your joints the support they need to thrive. 4. Hot and cold therapy. Hot and cold therapy is a classic technique that leverages temperature to ease joint pain. The science behind it is straightforward. Heat increases blood flow, relaxing muscles and reducing stiffness, while cold constricts blood vessels, reducing swelling and numbing pain. A 2018 study in physical therapy confirmed that alternating hot and cold therapy can significantly improve joint function in arthritis patients. To use heat, apply a warm compress, heating pad, or warm towel to the affected area for 15 to 20 minutes. This is especially helpful for morning stiffness or chronic pain. For cold therapy, use an ice pack wrapped in a cloth never directly on the skin, for 10 to 15 minutes to reduce swelling after activity or injury. Alternating between the two, 10 minutes of heat followed by 10 minutes of cold, creates a pump effect, flushing out toxins and bringing in nutrients. For example, if your knees ache after a walk, start with a warm compress to loosen the joint, then apply an ice pack to calm any inflammation. Repeat this cycle 2 to 3 times, ensuring you don't overdo either temperature to avoid skin damage. Sarah used this method after gardening, finding it helped her knees recover faster. Always test the temperature of your compress to avoid burns or frostbite, and consult your doctor if you have circulation issues or conditions like Raynaud's disease. Hot and cold therapy is a versatile, low-cost option that can be done at home, making it accessible for anyone looking to manage joint pain naturally. 5. Omega-3 fatty acids. One of the most powerful tools in your arsenal against joint pain is omega-3 fatty acids. These essential fats, found in certain foods and supplements, are renowned for their anti-inflammatory properties. A 2020 meta-analysis published in the Journal of Rheumatology found that omega-3 supplementation significantly reduced joint pain and stiffness in patients with rheumatoid arthritis. Another study, from Arthritis and Rheumatology in 2019, showed that a daily dose of 2.6 grams of omega-3s over 1 year could decrease reliance on anti-rheumatic medications for some individuals. These findings make omega-3s a compelling option for anyone looking to manage joint discomfort naturally. Omega-3s work by reducing the production of inflammatory molecules called cytokines, which contribute to joint swelling and pain. They also support cartilage health, the cushioning tissue between your bones, which is often compromised in conditions like osteoarthritis. While your body can't produce omega-3s on its own, you can easily incorporate them through diet or supplements, provided you get your doctor's approval. Fatty fish are the gold standard for omega-3s. Salmon, mackerel, sardines, and tuna are rich sources, offering both eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, the most potent forms of omega-3s. A 3-ounce serving of salmon, for instance, provides about 1.5 grams of omega-3s, making it a nutrient-dense choice. If fish isn't your thing, plant-based sources like flax seeds, chia seeds, walnuts, and hemp seeds contain alpha-linolenic acid, ALA, a type of omega-3 that your body partially converts to EPA and DHA. Oils, such as flaxseed oil or olive oil, can also boost your intake when used in cooking or dressings. For those who struggle to eat enough omega-3 rich foods, fish oil supplements are a convenient alternative. A 2018 study in Nutrition Reviews noted that fish oil capsules, typically containing 500 to 1,000 milligrams of combined EPA and DHA, were effective in reducing joint pain when taken consistently. Look for high-quality supplements certified by third-party organizations like USP or NSF to ensure purity and potency. However, fish oil can interact with blood thinners and other medications, so always consult your healthcare provider before starting. To make omega-3s part of your routine, aim for 2 to 3 servings of fatty fish per week, or sprinkle a tablespoon of ground flax seeds into smoothies or oatmeal daily. For supplements, follow your doctor's dosage recommendations, typically 1 to 3 grams per day. Sarah, my aunt from the earlier story, added salmon to her weekly menu and noticed less tenderness in her knees after a few months. She also started using flaxseed oil in her salad dressings, which made it easy to stick with the habit. While omega-3s aren't a quick fix, their long-term benefits for joint health are well documented. Pair them with other anti-inflammatory foods, like the ones we discussed earlier, for maximum impact. By prioritizing these healthy fats, you're not only supporting your joints but also promoting heart and brain health, making it a win-win for your overall wellness. 6. Capsaicin cream. If you've ever bitten into a spicy chili pepper, you've experienced the fiery sensation of capsaicin, the compound responsible for the heat. But did you know capsaicin can also soothe joint pain when applied topically? A 2017 study in pain medicine found that a 0.025% capsaicin cream reduced pain by 57% in rheumatoid arthritis patients and 33% in those with osteoarthritis over 4 weeks. This makes capsaicin cream a unique and effective option for targeted pain relief. Capsaicin works by desensitizing pain receptors in the skin, specifically the TRPV1 receptors, which transmit pain signals to your brain. Over time, repeated application reduces the intensity of these signals, providing relief from chronic joint pain. It's particularly useful for localized pain in areas like knees, hands, or shoulders, where you can apply it directly. The cream is available over the counter in various strengths, typically ranging from 0.025% to 0.1%, with lower concentrations being gentler for first-time users. To use capsaicin cream, apply a thin layer to the affected joint 2 to 4 times daily, following the product's instructions. Wash your hands thoroughly afterward to avoid accidentally touching your eyes or mouth, as capsaicin can cause a burning sensation. Some users, like a few in the 2017 study, may experience temporary discomfort or skin irritation, especially during the first few applications. If this happens, reduce the frequency or try a lower strength cream, but discontinue use if irritation persists and consult your doctor. For best results, be consistent with application, as capsaicin's effects build over time. It's not a one-time solution but rather a tool for ongoing pain management. Sarah tried capsaicin cream on her hands, which ached from years of gardening. While she found the initial warmth intense, after a week, she noticed her fingers felt more flexible. Always patch test a small area of skin first, and avoid applying it to broken or sensitive skin. Before using capsaicin cream, check with your healthcare provider, especially if you have allergies, skin conditions, or are pregnant. When used correctly, this spicy remedy can be a powerful ally in your fight against joint pain, offering relief without the side effects of some oral medications. 7. Turmeric. No discussion of natural remedies would be complete without turmeric, often dubbed the king of spices for its remarkable health benefits. This vibrant yellow root, a staple in Indian cuisine, contains curcumin, a compound with potent anti-inflammatory, antioxidant, and antiviral properties. A 2021 systematic review in Frontiers in Pharmacology found that curcumin supplements reduced pain and improved joint function in osteoarthritis patients, often rivaling the effects of nonsteroidal anti-inflammatory drugs NSAIDs, like ibuprofen, but with fewer gastrointestinal side effects. Curcumin works by inhibiting inflammatory pathways, such as those involving cyclooxygenase 2, COX-2 and nuclear factor kappa B, NFKB, which drive joint inflammation. It also neutralizes free radicals, protecting cartilage from oxidative damage. However, turmeric's bioavailability, how well your body absorbs it, is low in its natural form. Combining it with black pepper, which contains piperine, enhances absorption by up to 2,000%, according to a 2018 study in Foods. You can incorporate turmeric into your diet in several ways. Add a teaspoon of ground turmeric to curries, soups, or smoothies for a warm, earthy flavor. For a soothing drink, try golden milk, made by heating milk, dairy or plant-based with turmeric, black pepper, ginger, and a touch of honey. If cooking with turmeric isn't practical, supplements are a convenient option. A typical dose is 500 to 1,000 milligrams of curcumin per day, often split into 2 doses, but always follow your doctor's guidance. Look for supplements standardized to 95% curcuminoids and including piperine for optimal absorption. However, turmeric can interact with blood thinners, diabetes medications, and other drugs, so medical clearance is essential. It may also cause mild stomach upset in some people, so start with a small dose and monitor your body's response. Turmeric's versatility makes it easy to integrate into daily life, whether through food or supplements. Its long history of use in traditional medicine, backed by modern research, positions it as a cornerstone of natural joint care. By making turmeric a regular part of your routine, you're investing in long-term joint health with a remedy that's as delicious as it is effective. 8. Olive oil massage. Finally, let's talk about a remedy you can do right at home, an olive oil massage. Massage therapy is well known for reducing muscle tension and improving circulation, but using extra virgin olive oil takes it to the next level. A 2020 study in complementary therapies in clinical practice found that women with osteoarthritis who massaged their joints with olive oil for 4 weeks reported less pain compared to those using medicated creams. The secret lies in oleocanthal, a compound in olive oil with anti-inflammatory properties similar to ibuprofen. Massaging painful joints increases blood flow, delivering oxygen and nutrients while flushing out toxins. Olive oil's smooth texture reduces friction, making it ideal for deep tissue work. To try it, warm a tablespoon of extra virgin olive oil, not hot, just lukewarm, and gently massage it into the affected area for 10 to 15 minutes. Use circular motions and moderate pressure, focusing on areas like knees, elbows, or wrists. Afterward, cover the joint with a warm towel to enhance absorption. For convenience, you can do this daily, ideally after a warm shower when your muscles are relaxed. Sarah incorporated olive oil massages into her evening routine, finding them both relaxing and effective for her hands. While it can be messy, placing a towel under the area helps contain spills. Use only high-quality extra virgin olive oil, as refined versions lack the same anti-inflammatory compounds. Before starting, check with your doctor, especially if you have skin conditions or allergies. Avoid massaging over open wounds or severely swollen joints. This simple, cost-effective remedy combines the benefits of touch therapy with olive oil's healing properties, making it a practical choice for daily joint care. We've covered a wealth of natural remedies to help you manage joint and bone pain, from Epsom salt baths to olive oil massages. Each approach offers unique benefits, backed by science and practical for home use. Sarah's story shows how combining these remedies, dietary changes, gentle therapies, and consistent care, can transform your daily experience. Before we wrap up, a reminder, always consult your healthcare provider before trying new remedies, as individual needs vary. If you found this helpful, give the video a thumbs up, it supports the channel and helps us create more content like this. Subscribe and hit the bell icon for updates. Share your favorite remedy in the comments below, we'd love to hear what works for you. Thanks for watching, and here's to healthier, pain-free days ahead.